we may not see the sun right now. The FDA is warning that pills and supplements do not work as sunscreens. Here's Dr. Richard Chaffoo with more. Dr. Chaffoo, we were just talking about this, I think it was last week that I heard about these pills. So people are taking pills for sunscreen now?
Well, they're thinking about it, and that's what these supplement companies unfortunately are advertising. These are pills that you can take that purportedly protect your skin and your eyes against the harmful ultraviolet rays of the sun.
Okay, so what are they? I've always thought sunscreen is something that you rub and you see it protecting your skin. So they're claiming by taking this, you're...
That's a big reach. We don't know. There's not science, but there's a big pause there. So the theory, their position is, well, they're taken internally and somehow that has a protective effect. But you're absolutely right. If you take something internally, we're used to taking medications for hypertension, for cholesterol that work internally. How would something go from being an internal agent to getting out through the skin and having an outside effect?
Okay, so I just want to read. Is this what they are saying? What a quote that I have is that just one capsule per day provides natural healthy protection from UV rays, strengthen your skin's defenses against ultraviolet radiation in the form of a daily supplement designed to improve skin health. Take an additional capsule if exposed to excess sun. I would read this no, that doesn't make sense. That doesn't make sense.
It's counterintuitive, you're right. And that's unfortunate. You know, as you know, supplements are not regulated by the FDA because they're not considered drugs.
Is that how they've made it onto the market?
There is it's a multi-billion-dollar industry, of course, where there's not really any oversight, there's no regulation, and most importantly, there's no real scientific studies that have been done to demonstrate the effectiveness. That's where the FDA's come down on drugs. You know, you have to have very strict clinical trials repeated in multiple institutions over a long period of time before a drug can be released to the public and before they can make the claims that they do make. But Shally, with the supplement industry, that's not the case. They're not held to the same standard that the drug industry is.
So we have to have that conversation again, Dr. Chaffoo, when we just kind of remind everybody what are the real ways that you can use to protect your skin.
So the sun precautions are things like, if you're going to be out in the sun, try to avoid that 10 a.m. to 4 p.m. time when the sun's more directly overhead.
Okay.
You want to wear sun protective clothing outside with a hat with a wide brim. There is clothing where there's SPF built in. Sunscreen, sunscreen, sunscreen. Put it on about 30 minutes before you go outside. And if you're outside for 2 hours or longer, you need to reapply that sunscreen, at least an SPF of 30. And don't forget your sunglasses, because they actually are the sunscreen for the eyes.
Yeah, I learned very late in life that there are sunglasses that make you look cute.
Yes.
And then there's sunglasses that actually protect your eyes. So,
yes, and they're getting better. I mean, there is definitely. So you want something that has both UVA and UVB protection.
Right.
They should probably protect somewhere 98 to 100% protection. And they're out there, but they haven't been cute in the past, but I think that's something they're working on now.
And even the polarized, like they say to get the polarized ones to really protect your eyes. I've been getting the cute ones, and I was like, really? I thought these protected my eyes. So the takeaway, is there any pill, anything that you could be taking internally to protect from the sun, or is all of this the external, the creams, the sun, the hat?
No simple way, and the answer is no. If it sounds too good to be true, it is.
It is. Dr. Chaffoo, thank you for being here. Always good to see you.